Hey, it's Jessica DeMassa with WTF Health. What's the future of health? I'm talking to the who's who of health tech and healthcare innovation and catching up right now with Chris Molaro. He's the CEO of NeuroFlow. NeuroFlow just closed a $25 million round. Pretty exciting news there. We talked to you like a couple weeks ago, like right before, but I wanted to catch up with you because I love where you guys sit in the space. So NeuroFlow has IT infrastructure technology that helps providers identify people who might have behavioral health issues and helps triage them. And so you're like helping providers figure out who might need mental health care and then trying to get them to the right place. But say a little bit more about it so that those who may not have caught that earlier interview can understand who you are and what you guys do.
For sure. So I'm going to open up the same way I did the last interview, what we're not.
Okay.
We're not a telehealth company. We're not providing care. We partner with primary care providers and other non-behavioral health providers. And then on the health plan side, we partner with care managers to identify underlying behavioral health conditions. Someone that has diabetes probably has a co-occurring depression or anxiety, and that impacts the overall health. So we identify them, we send them to the right level of care, and then we, importantly, follow up with them to make sure they're getting better and improving, and if not, we could adjust that treatment appropriately.
All right, I want to hear about how your technology is deployed in the provider organization. Are you guys integrated into the EMR? Like, how do you guys get that in front of the provider with what you have to offer?
Yes.
Okay.
We have to be. I mean, look, we just wouldn't get adoption in the market if we were adding more work to the provider workflow. So we like to say that we're very configurable and modular to what their workflow needs are. The idea is we're going to go to a system and say, how are you doing this today? How can we amplify it and scale it with you, as opposed to saying, this is the way it works, take it or leave it. Integrating in the EMR is a big part of that. So when we do it right and the partnership works, PCPs and other providers end up doing less work with more impact because the technology is able to automate a lot of that.
All right, talk about the automation piece of this and how this works, because behavioral health, identifying it, triaging it, you're empowering different levels of care provider who may or may not be familiar with different types of behavioral health disorders and how they present. So how are you offloading that burden and putting it onto the software as opposed to putting it onto the practitioner?
Well, again, we love to say high tech, high touch. Okay. Technology is not going to solve this problem by itself. But today, if I go see my PCP, they're assessing me for depression, maybe. Not everyone does it, and it's not in a standardized way, but let's say they do. If I screen positive, it doesn't matter what level, severe, mild, or moderate, they're going to give me an antidepressant prescription, they're going to refer me to a therapist, and then I'm going to leave. And they have no idea if I can follow up, if it's working, and most people don't go get that care. So the software automates the assessment of it. We standardize that. We make sure it happens in between appointments, and then the care coordination thereafter is all done through the technology.
All right. Screening just for depression or other things too?
Oh my, no. Depression, anxiety, PTSD, we have 30 different assessments built in, even addiction and substance use disorder, all of which have mental health related issues.
Talk to me about the investment, because I love where you guys sit in this space, and we're all talking about the investment market right now and the digital health and health technology and what's going on and how much has changed. But you guys are in an interesting spot because two hot areas, mental health and like the IT infrastructure space. So tell me a little bit about the round that you raised, and then we'll go from there. But tell me a little bit about the round and who led it.
So SemCap Health, so short for Seminole Healthcare, is a VC local in Philadelphia. So we're a Philadelphia-based company. It's kind of interesting how it happened. So they reached out to us in January of this year. We were in a place where we weren't fundraising. We didn't need the capital, but it piqued our interest because we thought, well, there's a lot of uses that we could use that investment for in terms of growth, going really deep with our integrations, talk about, so Epic, Athena Health we're in, but we want to do Cerner, eClinicalWorks, all of the other EMRs, and that's what this investment's going to be fueled for. So that relationship, I think, was a serendipitous timing, and we're just really excited about it.
All right, that's very cool. What do you think about that whole mental health tech space, just generally speaking? I mean, you're obviously somebody who watches what's going on in this space, and then there's a lot of other companies that are kind of creeping into your territory. So, what do you think about what's happening in the mental health tech world?
Number one reason I opened up with what we're not is because it is such a busy space right now. There are a ton of telehealth, teletherapy, and psychiatry providers. And by the way, they're all doing a lot of great work. Yeah. And they're important. But we're different. And we're actually partnered with a lot of them. We have a clinical referral network where we send people to like Array Behavioral Health or Able to, Brightside, and so forth. And what's really neat then is we could sit between the primary care provider and the teletherapist and be the ubiquitous user experience to make sure those gaps in care are narrowed. And that's just really unique. That clinical feedback loop that we've developed where we have an engagement solution and a clinical decision support solution is just very unique in the market.
All right, talk to me about some outcomes. Give us some idea of what kind of an impact you're making.
Sure. What's cool about the integrated behavioral health model, which is what we believe in, right, when we work with primary care providers, is that it's not a new concept. It's been around for decades. It has hundreds of peer-reviewed randomized control studies and so forth. The problem is it's just complicated. It's not standardized, it's expensive, and so it doesn't get adopted the way it needs to get adopted. With technology, we help them adopt it efficiently and at scale in a sustainable way. And when you do that, you see we reduced Jefferson Health's emergency department utilization by 34% compared to a control group. If you extrapolate that out, that's a ton of resources and money that could go back into the health system. Not only are we showing a reduction in depression and anxiety, but we see an improvement on their physical health side too. We just published a study with a chronic pain group that we work with. Not only did we show an improvement in their mental health, but their pain improved and the opioid usage decreased. So it just shows that mental and physical health impact each other, and that's the impact that we're seeing.
That's awesome. Well, that's good. I mean, that's one of those things I feel like we all know that, and we all want to
Right.
live in a healthcare system that does that, but
Right.
that integration is very difficult to manage. But
For
all
sure.
right, Chris, leave us with some thoughts about what's happening next. So you talked a little bit about using the funding to expand and be able to integrate with Cerner, was it Cerner?
Yeah.
Getting into the other EMR companies. So what
Yeah.
else are you guys going to do?
Well, there are a ton of EMRs, and then for our payer partners, there's the care management systems,
okay.
right? And so really putting our back end, the data science, the analytics of what we do into our partners' existing systems, minimizing those workflows. And that doesn't happen overnight. It's really difficult to do that. So we're going to be investing a lot in that growth and getting more and more. We're onboarding a lot of providers, some of which will be announced here in a few weeks. But we're really just excited about helping to bring the healthcare community closer together so it's not mental and physical health, it's just health.
Very cool. Well, Chris, thanks for stopping by. It's great to catch up with you. Congratulations on the fundraise. We'll talk to you
so
soon.
much.
All right,
Appreciate it.
thanks a lot. I'm Jessica DeMassa here at Health 2022, talking to the who's who of health tech. You can catch more interviews on my YouTube channel. It is youtube.com/WTF Health. Talk to you guys real soon. Thanks so much. Bye.